started. Dr. I'm going to say Carr and hope I'm correct. I know some persons pronounce it Kerr. I didn't get a chance to ask before the meeting, so I'm hoping that I got it correct when I say Dr. Carr. We're gonna have him share with us this evening on the topic, and I'm sure this will help all of us here on the call, as you know, men take on several roles in society, include save off roles in the family. And so if it is that their mental health is protected and safeguarded, then our families are protected and our businesses and our communities. So men's mental health is everyone's business. We are approaching, as I like to say, this is the last lap of the administrative year, and so I'm going to be inviting us all to to ramp up or contributions or support. So for those persons who still have funds outstanding from or Barbie Fry, I ask that you try to settle those so that the club can be in a better position to finish the year strong. If it is, and I would hope that we don't have persons who still have funds outstanding from the Christmas ball as well as the Rose of Sharon benefit performance. But if it is that you do still have funds outstanding for those, we ask that you make your payments, you fulfill your obligations to the club. We still want to make our donation of canes to the Salvation Army School for the Blind. We still want to ensure that we cover that obligation. We have given our word, and I want us to be able to stand by it. And I also want us to deliver where we promised with the Chevron's Basic School in Standpipe. We had committed to assisting them with fixing the plumbing in the kitchen and providing them with some shelves. And this will help to better not only the school community, but the lives of the children. And I still want us to be able to do that. But the only way we'll be able to do that is if it is that we have the funds coming in so that we can fund the projects. We're still trying to see how best it is that we can provide reading corners for at least five of our schools. So we still need support in that way. So if it is that you can point us to where we can get bookshelves, where it is that we can find bean bags at reasonable price or even free to see how best we can complete that project. That is something that we still want to do because we still want to help the children with their reading in at least five of our schools with builders clubs. And that's where I'm going to leave my opening remarks for this week. And I'm going to now invite Vice President Andrew Burton to do the official welcome and roll call of clubs.
Hello, hello, evening, everyone. Welcome to another meeting of the Kiwanis Club of Kingston. Um, we celebrate Men's Mental Health Month. This is our second meeting in the month of June. Last meeting, we heard from two of our newer Kiwanians up close and personal. And this evening, I want to give a special welcome to Dr. Carr, um, a colleague, and I've worked with him before as my intern at the hospital. And I look forward to hearing what he will share with us this evening. Um, if there are any guests online who have joined to hear what he has to say, other medical colleagues, other persons who are just interested in learning about mental health issues um, that are unique to men, welcome. As we go into the roll call, as we usually start off with, I invite any Kiwanians who are joining the call from clubs outside of Jamaica. Please unmute your mic. Let us know where you're from, how big your delegation is. If you're here alone thus far, let us know. We're 24 strong on the call. Anybody here from Kiwanis clubs outside of Jamaica? Okay, not yet. I started the trend to continue it. Shout out to our members who are outside of Jamaica. DP Paul, I see you. Kiwani and Aheje, I see you, and we'll hear from you shortly in the meeting. But welcome, good to have you, gentlemen, on the call. For Kiwanians who are from Division 25. Any Kiwanians from Division 25 here on the call with us? No, not as yet. Any Kiwanians from Division 24? Kiwanians from Division 24. Not yet. Kiwanians from Division 23 East. Division 23 East.
Pleasant evening, fellow Kiwanians and guests. This is Director
Pleasant evening.
Tanisha from the Kiwani Club of South St. Andrew, bringing you greetings on behalf of President Carleen and our wonderful members. They're on their way and we'll be here shortly.
All right.
Thank you for the invite.
All right, love that. Love the optimism. Welcome, Director Tanisha. Thanks for joining us as usual. Any other Kiwanis clubs from Division 23 East? Okay, no. Any Kiwanians from Division? Oh, yes.
DLG Eileen here
The DLG Eileen, welcome.
On behalf of the Kiwanis Club of Worthington, Kingston President Chevelle, we are pleased to join you this evening in support of our men. We are all here just to gain more insight, awareness, and information how best we can support each other. Currently, we have 2 members on. Others will be joining. And I just want to shout out to President Zuri. Hello, everyone. Have a good evening.
All right. Thank you, DLG. And as a club of men, we thank you for not only your presence, but your support, your kind words. So any other clubs from Division 23, 23 West? Any clubs from Division 23 West?
Okay. Good night.
Good night.
This is your Aunt Annette.
Yes, this is a familiar voice, yes. Welcome.
I'm from the Kiwanis Club of Greater Portmore.
Yes.
I think I'm alone. I hope to enjoy our meeting.
All right. I hope so too. I hope you enjoy it as well.
Yeah.
Thanks, Auntie Annie.
Okay.
Any Kiwanians from Division 23 Central? The big entrance.
Good evening, everyone.
Good evening.
This is DP Joan from Nation Builders Kingston. It is indeed a pleasure to be here with all of you. I am solo right at this moment. I'm looking, but I'm not seeing anyone yet. But I know that more of my club members will be present. It is a pleasure, and I definitely look forward to the topic that is going to be discussed this evening. Blessings to you all, members of Club of Kingston and President. Blessings.
Good to see you, DP Joan.
Thank you. Same here.
Right. Any other clubs from Division 23 Central here with us?
Hi, DP. Andrew, how are you?
Hello, I'm great. Thank you. Welcome.
DP, you ready, Sam? I'm going to be brief.
Yes.
So brief. I'm not seeing anybody else except my reflection, not even the DLG who I would borrow.
Yeah. Right.
Not
Not
even.
yet.
Yeah. But I'm going to be here holding down the fort for 23 Central, sorry, online, on behalf of
Right.
President Maxine, who is presenting at another club. So I
Okay.
proudly stand here alone until
All
others.
right.
Okay, thank you so much. Have a good night.
Alone for now. Thank you as usual for joining us.
Yes, and I look forward to this topic. My only issue is that I'm fine with it being what, Education Month, or what did it say? Education Month?
Men's health.
No,
Men's health.
another one. Education Month, right? But
Right.
it being Men's Health Month, I don't know. I don't like when they choose these things when my birthday month. I like my birthday month to be only, nice things. So choose another month for men's health month. Okay, men's mental health. All right, you can tell them your month. What month you're born?
Oh,
What month?
mine? October.
Yeah, you can tell them October. All right.
All right. So we hear the petition to move Men's Mental Health Month to October. Started here.
Have a good night. Thank you.
All right. All right. Thank you, DP Eurydice. Thank you for joining us. Are there any of our SLPs, any of our Service Leadership Program members here? I guess unofficially we heard from the Action Club representative already. DP Joan, big up yourself every time. Do we have any other of our SLPs? Any SLP representatives on the chat so far? Not seeing any either. Any guests of Kiwanians? I think I see Dr. Kerr here on the call. No, I'm not sure if he was here in the beginning. Welcome, Dr. Kerr. Welcome to our meeting. And we so look forward. Everybody has echoed so far. We look forward to what you have to share. Any sorry?
Oh, so when you're ready for me to start, you can let me know.
Oh, sure. We'll let you know. Okay. Any guests of Kiwanians who are on the chat? If you are a guest who was invited.
SVP Andrew.
Yes.
Before I introduce my guests, just wanted to acknowledge DP Derek Clark,
Yes.
who is on the call. Welcome,
Okay.
welcome DP Derek. And I have two
Welcome,
guests.
DP. Yes.
One is Janet, who has attended a few of our meetings. I see her on the line. And my son Stefan, who is on the call as well. So welcome to you.
Okay, welcome. Yes, welcome. Thank you, DP Stu, for sharing your K with your guests.
Okay, thanks.
Any other guests on the call? No. Okay.
Hi,
Move along. Hello.
I joined late.
How you do, Pastor?
I am not bad. I'm from the Kiwanis Club of Montego Bay. I'm the only one on at this time. Looking forward to a great meeting regarding men's mental health. It's very important. Thank you.
Excellent. Always good to hear from you. All right. There being no other guests or no other visiting clubs, we move along. I hand the mic back to President Jury.
Thank you, VP Andrew. I have apology from DLG Desmond. He is currently attending the anniversary meeting of the Kiwanis Club of Constant Spring. Do we have any other apologies from any member of the Kiwanis Club of Kingston? DLG Willie, did you receive any apologies?
Yes, we have an apology from Director DP Richard Reese.
All right, so
That's all.
Any other member of the Kiwanis Club of Kingston?
And John.
All right, thank you. DP Stewart. All right, if there are no further apologies, I'll now invite President-designate Arsenio Sawyers to do recognition of birthdays and anniversaries.
Good evening again, everyone. We'd just like to acknowledge those persons who'll be celebrating a special day this week. We do have quite a few names here. On the 11th, we have a birthday. That's for Suzette, who's the wife of Kiwanian Gary Yisin. Then on the 12th, we have Jennifer, wife of DP Jeff Masado, celebrating her birthday. On the 13th, we have PD Eric Malcolm and Samantha, wife of DP Gian Demel, celebrating their birthdays. Then on the 14th, we have an anniversary for Yolande and PDT Ralston Nunez. So happy birthday, happy anniversary to you when it comes. We'd just like to point out as well that June 11th would have been the birthday of PD Trevor Ford, who's the longest serving member of the Kiwanis Club of Kingston, who unfortunately passed this week. If there is anyone else on the call celebrating a special day this week, feel free to open your mics and share with us. Okay, there being none, happy birthday again to all those who will be celebrating this week. Happy anniversary to PDT Ralston Nunes and his wife, and I'll hand back to you, President Zuri.
Thank you, PD. To all the persons celebrating whether birthdays or anniversary, wish you all the very best and many happy returns. We'll now have Kiwanis education, which will be done this evening by DLG William Reeson.
Thank you very much, President Zuri. Good evening, all. This evening's Kiwanis education is taken from the Kiwanis Standard Form for Club Bylaws, Article 4, and I thought it may be timely at this time. Admission to membership and resignations. Section 1. Prospective active members shall be considered for election to membership by invitation only, or by transfer from an active Kiwanis club under the following procedure. Each proposal for membership shall be submitted by a member of the club to the Secretary or the Committee on Membership Growth and Education, which proposal shall bear the signature of the proposer and the endorsement of all of at least one additional club member, both of whom shall be members in good standing. All proposals for membership shall be submitted to the Board of Directors for consideration. Each proposal for transfer may be submitted by a member of an active Kiwanis club directly to the Board of Directors for the purpose of changing club membership. Transfers must be requested within 6 months of discontinuing active attendance in the original club. At a meeting of the Board of Directors at which a quorum is present, members shall be elected and transfers accepted by a 2/3 vote of those present. Upon favorable action by the Board of Directors, the new and transferred members shall be notified personally concerning the action of the Board, and the membership induction fee shall then be secured. Currently, admission fees is $2,000 and the annual dues is $17,000. The official admission into club membership shall be the date the foregoing requirements are completed, and that date shall be reported to Kiwanis International. Let's read the next two sections. Where a member may resign from the club provided that such member's indebtedness to the club has been paid. The resignation shall be submitted in writing to the Board of Directors and shall become effective when accepted by the Board. Such individuals shall forfeit all interest in any funds or other property belonging to the club and all rights to the use of the Kiwanis name, emblem, insignia, or other Kiwanis marks. And lastly, senior or honorary members shall be elected by a majority vote of the entire Board of Directors. So Kiwanis, that and guess that's your Kiwanis education for this evening. That's so hope some of us may retain some of that and find it useful in recruiting new members for our Kiwanis Club of Kingston. Over to you, President.
Thank you, dear G. Willie, and I endorse that. I'm going to also ask that our Kiwanis Club of Kingston members share your K. Invite your friends to come on out to join the mission of service, right? At this time, we'll move to the main event, and to do the introduction of this evening's speaker, I will invite DP Stuart Spencer.
Thank you, President Zuri. Just testing, is everybody able to hear me clearly?
Yes, we can.
Okay.
Yes, we can.
Just let me just begin by saying that I'm using my phone, and when I use my phone and I'm trying to read from my phone, I can't see how I'm positioned on the camera. So if it goes off, forgive me. Okay, I'd like to, fellow Kiwanis and guests, this is my pleasure to introduce our guest speaker this afternoon, who is Dr. Kevon Kerr, and he is a dedicated professional with a broad range of academic achievements. He holds a BSc in marine biology with a minor in demography, as well as an MSc in nutrition. He also holds a Bachelor of Medicine and Bachelor of Surgery degree, MB and BS. And currently, he is a medical resident in the Doctor of Medicine program in psychiatry at the University Hospital of the West Indies. His passion for research has led him to publish articles in the fields of health and gender studies. He's committed to making a difference in the world by contributing to the advancement of medical research and the development of innovative solutions to global health challenges. As a highly motivated individual, he's constantly seeking new opportunities for growth and development. His unique combination of skills and experience uniquely positions him to make a positive impact on the world, and he's excited about the possibilities that lie ahead. And I wanted to say a special thank you to Dr. Kerr, because he did step forward at very short notice. So I am most appreciative that he has been able to make it this evening. Dr. Kerr, over to you. Thanks again.
Hi, good evening, everyone. So I have a PowerPoint presentation actually to accompany this talk.
Let me give you sharing screens. One second.
All right.
Okay. I noticed you didn't put the doctor, so I'm looking for the K.
All right.
I'm not seeing it. I know I saw it earlier. Where is the K? All right, let me just type it in. Okay, you're good to go.
All right, let's see if will come up. All right, is everybody seeing?
Yes, we can see it.
Yes.
Let's see. Oops, it's coming off. Here we go again.
You can see it.
All right, are you seeing regular view or are you seeing in presenter view?
Looks like regular view.
Yeah.
Okay. All right, so good evening again, everybody. So
good evening.
Today we will be presenting on mental health with a focus on men. Sorry. So in terms of presenting on mental health, while the focus will be on men, some of the statistics and some of the suggestions, because some of them are similar for both men and women. So we'll see that some of the things are covering both men and women. So the session has a couple of objectives. So first, we'll look at why mental health is important for men, why there needs to be a specific focus, including differences in help seeking and the way distress may be expressed. We'll also look at common presentations in men and certain subtle differences that may occur between men and women. It's also important to not assume that depression or anxiety always looks the same way in both men and women. So that's one of the main reasons that we'll be looking at that. I'll also aim to identify cultural, social, and systematic barriers to care, as well as discuss practical solutions in terms of covering mental health and the resources available locally. Well, some of them. All right, so why do we need to focus on men's mental health? So the reason for focusing on mental health in men is because not only is the response and the presentation slightly different in some instances, but men are also adversely affected by certain mental illnesses more frequently in comparison to women. The issue is that men may be socialized, particularly in the Caribbean context, to minimize emotional pain, avoid vulnerability, or cope privately. This means problems can remain hidden until they become more severe. And most of the times when I would see a patient, for example, a male, is when it becomes critical and it requires emergency care. As I previously mentioned, men also present differently. A man who is depressed may not say, "I feel sad." He may become irritable, he may stop showing up for work or for social gatherings. You might notice that he might be using more substances. He might try to distract himself by working excessively or not working at all, may complain of tiredness or isolate himself. The practical message is that we need to widen our lens in terms of how we look at mental health and how it presents, or mental illness, I should say, and how it presents. So when we recognize distress earlier and respond without judgment, we can help to reduce the chance that the person receives the well-needed help. So just to go through some key facts, we're looking at both a local and a global perspective. So globally, the World Health Organization reports that more than 720 persons die by suicide each year, and that 73% occur in low and middle income countries like Jamaica. WHO also estimates that depression among adult men is about 4.6%. And again, this statistic is across the world. The individual countries have different statistics. In the US, for example, CDC data shows that male suicide rate in 2023 was approximately 4 times the female rate. For Jamaica, a 2024 study done by the Jamaica Information Service reported that men accounted for more than 80% of suicides in the reference period. So in general, the suicide rate is higher among men, but the suicide attempt rate is higher among women in Jamaica. Meaning, while more women attempt to end their lives, more men are successful at doing it. And this tends to be because men tend to use more aggressive methods like stabbing themselves in the chest, for example, or for a patient that I saw recently who used a gun to shoot himself in the chest, or another one that I saw who used a knife to cut his throat. Luckily, all of those persons survived, but with a lot of disabilities. Women tend to use more subtle approaches. They might do overdose. Most commonly, Panadol is what we see a lot of women coming into the emergency room when they try to end their lives. But most of the times, the method chosen by women in comparison to men locally do not result in them actually dying. So that's why we would see that the suicide rate is higher among men. Now, these statistics aren't meant to frighten the audience, but they just show why timely connection, accessibility to care, and stigma reduction matter. And we see a lot of work being done on reducing stigma, being done by Ms. Camille Buchanan from Bellevue, trying to reduce the stigma among mental health. And since she started her campaign, I can say even at the hospital that I work, we've seen a greater uptake of persons coming in seeking mental health. So that is seeming to be very effective. Now, men's mental health, it occurs on a continuum. So a simple way to kind of frame it is we move along a continuum, as you might see in this diagram. So someone may move along from being well in terms of their mental health to coming to a crisis. And someone may move along this continuum depending on life stress, sleep, relationships, finances, trauma, illness, and level of social support. So at the far end in green, we see where there is well-being, meaning the person is not perfect, but they're functioning, they're connected, they're able to recover after a stressful event. So for example, someone might lose their job, but they might be able to recover. Because again, stress is a normal occurring phenomenon. But when stress becomes persistent, it can progress to distress. Now, distress is when the symptoms begin interfering with sleep, it begins interfering with personal relationship, work relationship, it begins interfering with work, with studying, with self-care, or with decision-making. A mental disorder is present when symptoms meet clinical criteria, and in Jamaica, we use a specific set of criteria called the DSM-5, but there are other systems that are used across the world. When it becomes this point, when it comes to this point, it requires structured assessment and treatment. Crisis means there is an immediate safety concern for the individual. This continuum reduces stigma because it reminds us that people do not suddenly become mentally ill. Difficulties can build over time, and early support can help to prevent deterioration. Now, how does distress show up in men? As I mentioned earlier, it might not be the traditional presentation as we might see in women. So one of the central points is that distress in men may not look like a classic picture. Some men may withdraw and become quiet. Others may become more irritable. They may become more argumentative. You might find that they become more impatient or more reactive to usual stressors that they might be able to cope with. So for example, somebody might step on their toe without a mental illness or without them being at a point where they require help, they might accept a sorry. If they're already at a critical low point, you might find that the level of aggression might be excessive. Now, some of the men might also they might realize that something is wrong, but in regards to health-seeking behavior, men in Jamaica or in the region in general and several other countries in the world, health-seeking behavior tends to be poor. So persons might try to cope through their own methods. They might cope by overworking, might stay constantly busy to distract themselves from whatever it is that they're going through. You might find that some persons might turn to gaming, video games, or gambling. They might start using substances or avoid family and friends. Some may also have some physical symptoms of their stressor. You might find that there are more frequent headaches, might feel fatigue, disruption in sleep, in terms of having palpitations, if they might be panicking or anxious about something, and there might be some stomach symptoms like nausea and diarrhea. And there are also some chronic aches in the body that can be connected to stress, because again, when persons become stressed, their body release hormones are released, mainly cortisol, but other hormones are released, and this can have physical manifestations. So persons with high levels of cortisol, for example, tend to be predisposed to hypertension, diabetes, as well as many heart diseases. And high levels of cortisol, especially if they occur from a younger age, can actually change the architecture of the brain, meaning it can change the physical. It can, some studies and some scans have shown that it has actually led to atrophy or shrinking of the brain. And these are long-term when there are these architectural changes in the brain. So we can see that stress can literally kill somebody. Now, when we look at mental illness in men, there are a wide variety of mental illness, and these mental illnesses as present in women as well. However, men's mental health is often a hidden issue, not because the conditions aren't there, but because men are conditioned to mask their pain. So we're going to look at some of them, not in great detail, but just to glide over or just to glaze over some of them. So in terms of depressive disorders, they impact over 6 million men annually, but it really looks like textbook sadness. It usually presents as severe irritability or chronic fatigue, or you might find some of the persons saying that they have this persistent low feeling. So depression does not always present as sadness. There's also something called anhedonia, which is essentially a feeling of low motivation that is also an important component of depression. In terms of anxiety and panic, it affects more than 3 million men worldwide, who often internalize excess worry as physical tension to avoid looking weak. Men are also twice as likely as women to misuse drugs, such as alcohol, in our context, cannabis, and in more recent times, Molly, than in comparison to women. They often use these to help to self-medicate to mask underlying emotional pain. There's also post-traumatic stress disorder and trauma, which affects a huge portion of the population, with roughly 60% of men experiencing a major trauma throughout their lifetime. This often leads to hypervigilance and emotional numbing in some men. There are also bipolar and psychotic disorder, which represents severe mental illness, notably for early onset psychosis like schizophrenia. If it's diagnosed before age 30, if you check the statistics, you will find that a staggering 90% of those diagnosed are young men. There are also other things like adjustment difficulties, which hit men hard during major life shifts like a job loss or a divorce or severe illness, which can completely shatter a man's sense of identity and purpose. Now, there's also, looking at the data over the right, there's also a treatment gap. So while a lot of men have these things in terms of getting treatment, there is a significant problem. Only 41% of men with a mental illness seek help voluntarily, compared to nearly 57% of women. And this is because they don't speak up, they suffer in silence, they externalize their pain through anger, overworking, or reckless behavior. And this silence carries the ultimate cost, because as previously mentioned, men account for the majority of all suicide deaths. some local statistics in terms of Jamaica. So before mental, neurological, and substance use disorders and suicide account for approximately 40% of all years lived with disability in Jamaica. This highlights the mental health conditions are not rare or isolated conditions, and they affect us in Jamaica similarly to other countries in the world. They contribute substantially to the nation's overall burden of disease. Depression alone is estimated to affect about 14.3% of Jamaicans, which means roughly 1 in every 7 persons has experienced depression. More recent research done locally confirmed this 14.3% of adults, including about 10% of men, suggesting that a significant proportion of Jamaican men experience psychological stress. Another important concern is suicide. Although women may report more mental health symptoms more frequently, the majority of suicide deaths in Jamaica are men. Just to highlight that point, men have a higher suicide rate than women in comparison to women. So focusing now a little bit on depression in men, here are some of the symptoms or the signs that you need to look out for, or some of the symptoms that men tend to report. Now, you might hear men describe, or not describe sadness directly, but they may say they feel tired, they feel fed up, they feel stressed, they feel angry, or they feel numb, but they will sometimes try to avoid using the word feeling sad. You may find that they stop enjoying things that they previously liked, become less affectionate, miss work, isolate. They may also present to primary care physicians or go to their general practitioner complaining of unknown pain or feeling sad or GI symptoms, well, stomach symptoms like diarrhea or constipation in some instances. So for example, you might hear someone say, I'm just stressed, but they may still be functional at work and just brush it aside, not tackling what the immediate issue is. So when we hear, I'm just stressed, we can use this as an opening to ask about sleep, ask about appetite, ask about their level of concentration, their level of enjoyment, and about how they are functioning. It's very important to assess safety in terms of persons reporting these symptoms in a very calm and non-alarming way when depression is suspected. We want to avoid judgment, and we want to also avoid shameful language. Now, substance use is an important part of men's mental health because some men use alcohol, cannabis, and other stimulants or other substances to manage distress they feel they may not be able to discuss with the persons around them. The substance, it may provide short-term relief, but it can also, in the long term, or sometimes in the immediate term, worsen sleep, worsen mood. It may worsen their finances because they might be missing their work and spending excessive amounts of time using the substances. It may damage relationships, it may affect work performance, and it may also impact on their physical health. It can also make diagnosis more difficult because some of these symptoms overlap with the actual symptoms of the mental illness itself. So a helpful approach that we like to use is to avoid moralizing. Instead of saying, why are you doing this, or why are you smoking so much weed? We can ask, what does it help you cope with, or what happens emotionally when you use the substance and when you try to cut down. This somewhat opens the door to integrated care. So we end up treating the substance use and the underlying depression, anxiety, or trauma simultaneously. Now, mental health is shaped by more than biology or personality. The conditions in which we live, work, learn, and age matter a lot. Certain social determinants of mental health include financial stress, unemployment, underemployment, unsafe communities, relationship strain, chronic pain, physical illness, and discrimination. And all of these things can increase vulnerability to men in regards to them developing a mental illness. Men may also feel intense pressure to be providers, protectors, or problem solvers, and they may experience shame when they cannot meet those expectations. Now, in the Jamaican context, economic pressures, migration, family separation, violence exposure, and stigma can be relevant. A social determinants approach helps us to avoid blaming men for struggling. It also reminds us that effective prevention includes social support, in the workplace as well, by having employment policies, by having violence prevention programs, also by making healthcare affordable, because not being able to afford healthcare is one of the barriers. And further along in the presentation, I'll just talk about a few of the barriers to accessing mental health that we find locally. Now, one thing of concern is masculinity. I don't know if you've ever heard the term toxic masculinity before, but masculinity can be beneficial as well as harmful. Many masculine values can be protective, such as being responsible, promoting courage, loyalty, discipline, and commitment to family. The problem is when masculinity becomes rigid and punishes persons who do not meet these criteria. For example, if a man believes he must always be in control, he must never cry, he must never ask for help, and must solve every problem alone, then normal distress becomes harder to discuss, because in these instances, men may feel as if they are not good enough or not meeting to what society expects from them. So what we try to do, or what we should do, is to try to widen the definition of strength. Strength can include, for example, saying I'm not coping. Strength could include attending therapy. It could include taking medication when needed, apologizing after anger, resting, and allowing trusted people to help. So asking for help is something that we want to promote as a means of having strength, or as a way of showing strength, I should say. Now, in Jamaica, culture can both protect and challenge men's mental health. Faith, family, humor, music, sports, community, and support and resilience are powerful strengths. At the same time, some cultural messages discourage men from expressing emotional pain. Men may fear being labeled as weak, unstable, or mad, because it's a word that we like to use and throw around. Some may even worry about confidentiality in smaller communities, and this may be a deterrent for persons wanting to go seek help. In fact, even my own practice, I see persons travel from as far as Westmoreland to come to Kingston to seek mental health care. And their usual remark is, oh, I don't want the people in my community know, say, I have mental problems. So I would rather drive all the way from Westmoreland to Kingston rather than use the services available in closer proximity. Also, another thing in Jamaica is that some persons may prefer using a spiritual support first, which a lot of Jamaica is predominantly Christian, and this may be helpful, but it can, in some instances, delay clinical care if symptoms are severe. And not only just religious seeking spiritual services in terms of Christianity, but in terms of alternate practices. So for example, there was one male that I saw sometime last year, I think, before bringing him to the hospital because he was displaying some symptoms, talking to himself. His mother decided to bring him to a man who cut a rabbit's neck and drained the blood over his head in hopes of curing his mental health symptoms. When that didn't work, no, that's when she brought him to hospital saying that the magic never good. So we see how that could have caused a delay because she waited at least a couple of days to see if the effects would take in before actually bringing him to the hospital. So what we want to do in terms of marrying spirituality with services is to build bridges with like the faith leaders, with the families, with the barbers, with the coaches, with the teachers and the clinicians. because it can be useful. So a couple years back, one of my consultants was telling me about a person who practices, well, what we would term as obia. They had a place where they would do it near Bellevue. And what they would do is when the persons would come over there, they would say, go over Bellevue first and make them give you a tablet, and then you come over here and then I will work it magic on you. People would go over there and get the tablet, and when they go over to him, they would get better. But they're not saying it's the tablet made them get better, you know, they're saying it's because them come back over there to him. So but that indirect partnership was working because at least the persons were listening to him to go to see the care. Whether or not he was collecting money from them for it that's with the people, but at least it was encouraging persons to go and seek the care. Now, what does the mental health landscape look like in Jamaica? Now, Jamaica has an established public mental health system, included community mental health services and national coordination, which most of it is coordinated through the Ministry of Health and Wellness. And there's a mental health unit. The ministry describes the unit as being responsible for mental health promotion, prevention, early detection treatments, among other things. Community mental health remains especially important because specialist services are not equally accessible everywhere across the island. In some of the more deep and rural areas, persons might find it quite difficult to seek mental health services. So having the community mental health services in those areas has helped significantly in terms of allowing access to mental health care for persons who need it. However, we still suffer from a lot of stigma. There's also staffing constraints, transportation barriers, and other costs. And there's also limited awareness, which can, because if you don't know where to go, then you won't go and seek the help. Which is why I mentioned earlier about the work, the good work that is being done by the CEO of Bellevue, because it's bringing awareness of mental illness and some of the symptoms and signs to look out to a wider audience. Now, focusing a little bit more on some of the barriers. Now, the barriers to accessing service, they may be at a personal level, at a relationship level, at a community level, at a service level, or at a provider level. Now, starting at the personal level, a man may not recognize that he is depressed or anxious. He may think he is simply tired, angry, or under pressure. Relationally, he may fear disappointing others or losing the respect of persons who they are in a relationship with. Now, at the community level, stigma and gossip can discourage disclosure. So a lot of persons don't want to go and seek the help because they are feared persons will talk about them or will stigmatize them and treat them differently because they know that they're seeking mental health services. At the service level, some persons have cited that they can't afford it. There are long wait times when they go to seek help. They don't have transportation. They are not available during the clinic hours. Some persons may have to work, and others have also cited privacy concerns, which can be realistic obstacles in terms of seeking help. Even when services are available, when there is a poor therapeutic fit, this can stop engagement. So a man who feels judged or rushed or misunderstood may not return to clinic even if he goes once. So another thing that also needs to be worked at all of these levels is reducing stigma and reducing all of the barriers there. We can do this through public education and service design, allowing confidential access, using male-friendly language, having flexible hours, and just being more respectful and having clear referral pathways for individuals who need help. Now, there are some groups that require additional help and there might be additional barriers for them. They require special attention because their risk may be higher or their access to mental health services might be lower. For example, adolescent boys and young men may be managing peer pressure, identity development, academic stress, unemployment, as well as the influence of social media. In comparison, older men may face isolation, bereavement, chronic illness, pain, and retirement related to the loss of their role or their previous role as a provider. Then there are also men that are exposed to violence or traumatic work, which may carry symptoms silently because a part of their job profile is showing a pillar of strength. There are also persons from the LGBTQ community that may face stigma, rejection, or have safety concerns, which may prevent them from wanting to go into to get healthcare services. Though to note, services are provided. In fact, there is a clinic that is usually held at the university hospital. We call it the sex clinic, where the mental, in terms of mental health, that it actually helps persons who are suffering with their sexual identity, and it also counsels persons who are transitioning from one gender to the next. There's also men in rural incarcerated areas or homeless or low resource settings that may have fewer pathways to healthcare. The takeaway from all of this is to avoid a one-size-fits-all approach in terms of doing interventions for mental health, and to promote effective support that matches the stage of life or the risk factors that the individual might have. Now, there are certain warning signs that we should look out for, or in terms of when a man is having these, in terms of them going immediately for mental health. Now, warning signs include major changes from the person's baseline, withdrawal. You might hear the complaint of poor sleep, irritability. You might start missing obligations, neglecting their self-care. We've had persons come in where the relatives said they haven't taken a shower for nearly 2 weeks now, even longer in some instances, and they live inside a house. I'm not necessarily homeless persons. There are also persons, or when we hear persons making statements about feeling hopeless or having unbearable stress, that's also a red flag that we need to look out for. We also need to look for behavioral changes. So you might see someone giving away all their valuable items or giving unusual goodbyes. Like a patient that I saw just said goodbye to all of their loved ones and said that they love them before attempting to end their lives. Thankfully, the person's mother went in and saw them hanging by the rope and was able to cut them down and bring them to hospital in time before they passed. But when you get those unusual goodbyes, that's a red flag sign. There's another patient that we saw that just gave away all of his money. He gave it some to a taxi man, he gave some to his mother and other persons, and went and jumped in a river and drowned himself. He unfortunately never survived when he came to hospital. So we shouldn't ignore these signs, because it's not just that the person is looking some attention. We should approach persons who have these signs with a calm response. Stay with the person if immediately. So stay with them if you have some concerns about their immediate safety, and just try to reduce access to dangerous objects as much as possible, like knives or poisonous substances that persons might use. And just about everything can be used, because we've had persons use things like pesticides, even bleach, or one person came in, they drank drain cleaner when they tried to kill themselves. So many people avoid asking questions because they fear they might be saying the wrong thing. So we need to know how to open a conversation with men and women as well, in terms of motivating them to go and seek help. So we choose private moments. You start by saying things like, I've noticed you haven't been yourself. You seem like you're under a lot of pressure. And just open questions, not to make them feel judged, and just to validate their immediate concerns without immediately trying to fix everything. For clinicians and some service providers, I guess if anybody here provides services, just need to look at engaging persons with respect, doing all the appropriate screens, and just asking about persons, how they're doing, about their finances, their relationship status whenever we see them. Just have a all-encompassing or holistic approach is the word I should use when we see persons. Now, in terms of treatment approaches, there are several different approaches that we can use to treat persons depending on what specific mental health condition they have. Treatment should be matched to the person, the condition, the severity, the risks, as well as the preference and availability, because not all drugs are available here and not all treatment methods are available in Jamaica. Psychological therapies can help men understand patterns of thinking, emotion, behavior, relationship, and trauma response. Medication, which a lot of persons don't necessarily want because persons just say, oh, I'm not like take pill going to make me more sick, which most medications do carry some side effect, but there's a risk-benefit ratio that we need to weigh. But medications can be very helpful for treating moderate to severe mental illness, particularly like for psychosis or depression or anxiety. There's also group therapy, and there are a few peer support groups locally that persons might have access to, as well as encourage persons to seek therapy or psychotherapy, which is usually done by a psychologist. We also recommend lifestyle changing strategies. So sleep, good sleep is the foundation for good mental health. Poor sleep worsens mood, worsens anxiety, increases irritability, and it decreases attention and concentration as well as impulse control. We should also recommend physical activity, which can improve mood and stress tolerance, but it should be realistic and safe. So nothing too extreme. Also, the usual things that we would recommend: proper nutrition, adequate hydration, and reducing harmful substance consumption. Connection is one of the strongest protective factors, connection to friends, to family, to faith, to community. So also try to promote connections. Men may also benefit from activities that combine connection with action, such as group sports. Like a lot of men might play football to relieve their stress, volunteering, music, and if they're religious, you can encourage them to partake in group faith-based activities. Families and partners are usually the first people to notice changes, so they also need to play a vital role in regards to treating persons with adverse mental health. So support begins with paying attention, asking early. Listening is more effective than lecturing, because lecturing might sometimes come off as judgmental. It's also important not to use someone's vulnerability against them in later arguments. So you might, for example, say, oh, now you did a ball last week. You did cry last week. When you get in an argument 2 weeks in the future or 5 months in the future, to try not to use person's vulnerability against them in later arguments, because that teaches them that they can't open up to you, and that opening up is unsafe. It also discourages help-seeking behavior. Some other practical help may include appointment reminders for the persons, and incorporate the family by having them set reminders, remind persons if they know that they have appointments, transporting them to their appointments, and just supporting them with their routines. Now, because a lot of males spend a lot of their time at work, school, training, or in organized group, these settings can also be used as an opportunity to help persons with their mental health. We should start in the workplace by training leaders to recognize changes in functioning at work and mood and behavior, to promote confidential support pathways in workplaces. Workplaces and schools should also address structural causes of distress, such as excessive workload, harassment, level of control, unsafe working conditions, as well as general or support from the persons supervising you. Persons, in some countries, they've also been introducing wellness days, which are useful in terms of helping persons cope or just giving them a breather when they probably feel overwhelmed. So putting up a poster is not enough, which is a common approach that we see in Jamaica. Poster is not enough if the environment that the poster is put up in there is no difference in change. There are also some community-based approaches that can work because they meet men where they already are. So we can use barbershops, gyms, sports clubs, community centers if we have them, and online spaces because social media is one of the most available or the easiest point currently in this modern time to get to persons, especially the youth population. So the goal is not to turn every barber or to turn social media into a therapy session, but the goal is to improve mental health literacy, to reduce stigma, to help persons to be able to recognize warning signs in themselves and well as others, and just to hear the viewpoints of other peers. And we have to use social media in particular to impact mental health positively, because there are also persons that come in that when asked how they learned about, for example, cutting themselves, because not all persons who cut themselves want to die. Some persons cut or burn themselves, we call it non-suicidal self-injury, just because impacting pain or inflicting pain on themselves makes them feel better. When you ask a lot of them, they say they learn it from social media. We've even found in one instance where there was a WhatsApp group dedicated to sharing methods of how you could hurt yourself right here in Jamaica. And then there are other things that, like with conduct disorder, where persons might learn or be over-sexualized, and you might find that they might engage in behavior that is not considered appropriate for the age, and they learn this through social media. So we need to use social media for good, not for bad. In Jamaica, there are a few resources. I just put a few of them here. You can call the Mental Health and Suicide Prevention Hotline, which in theory should be open 24 hours. And I use the word in theory. There's also the You Matter chat line, which is aimed at persons between the ages 16 to 24, and they have a number which in theory should also be 24 hours. There are also public mental health clinics where persons can call in, and there are also teams that when persons are having immediate crisis, that if there's a psychotic episode, where you can call a team to come in to carry the person to the nearest hospital that provides mental health services. So just to wrap up things, stigma changes when language changes, and when people repeatedly see safe examples, this reduces the level of stigma. Instead of telling men to man up, we can say speak up. We can say check in. We can say get support. Help seeking can be framed as responsible and protective. We can say, for example, a man who seeks help is protecting his health, his family, his work, and his future. We can also foster an environment where men are able to share stories and have some peer discussion, which can empower them, especially when they see that other persons are going through similar situations or similar stressors, and how they're coping. They can also learn methods to cope. And we should also ensure that all of this is visible and that confidentiality. We know, let persons know that the information that they are saying won't be used against them in the future, to kind of garner some amount of trust and faith in seeking mental health, help for their mental health, I should say. So this is a call to action just to say that we should include all persons from all aspects, families, the workplace, the community, and the government in terms of having policies that support mental health and health-seeking behaviors. So just to wrap up, the key take-home message is that from this presentation, men's distress is often hidden. Culture can be both a barrier and a source of strength. Stigma delays access to mental health care. Treatment works, especially when care is early, continuous, and centered around the person. Support must include multiple persons, the family, services, workplace, communities, and if relevant, faith-based organizations, as well as policy. And just to highlight that no man should have to struggle alone. Help is there if help is needed. Go out and seek the help if you think it's something that you need. And if you recognize that someone you know might need help, encourage them and guide and help them to seek help for their mental health. Well, these are some questions, some references, and that brings me to the end. Any questions?
Okay, thank you very much. Thank you very much, Dr. Kerr. The floor is open. I think, there might be quite a few questions, so don't be shy. Are there any hands up that I'm not seeing? Or anything in the chat? Dr. Kerr, let me ask you the first question. Well, I think I know the answer to this one, but tell me, which gender handles the death of a spouse better?
Women in general.
I thought so. I thought so. And how does one really know when that you need help? I mean, I know there are symptoms, but is it always somebody telling you that you need help, or how because most people don't think there's anything wrong with them. So how does somebody self do it?
So a lot of it is acceptance. So in a lot of the instances, persons are aware that something is wrong with them, but they try to brush it aside because of usually fear of stigma or seeming weak. So the first step is recognizing and accepting that something is wrong and tackling it from an earlier state. So if you see that your sleep is being disrupted, don't just brush it off and say, oh, this is nothing. If you realize that you're not eating much, because you usually would realize, but you would just brush it off as nothing. That's one of the key differences that we find between men and women in terms of health seeking. Women are more likely to go and seek out help when they sense something is wrong in comparison to men, which is why a lot of the men that we see them in the advanced stages when they are being forced versus them voluntarily going in. So to answer your question, yes, persons can assess themselves, but it starts with accepting that something is wrong, knowing what signs to look out for as well, reading through and just seeking help when you know that you need it, and don't necessarily wait until you get to a point where others have to force you to go in.
Okay, I see a hand up. Tamara, you could go ahead.
I'm not sure if you're referring to Tanisha.
Yeah. Yes,
okay.
I am.
Okay, no problem. Good evening, everyone. Dr. Kerr, that was a really insightful presentation. Just so much to digest. Sorry, but I wonder what might the role of social protection be in men's mental health and wellness, and if your reference to policy as a means of support would include social protection.
Yeah, one of them would be social protection, because social protection comes in many forms. It comes in terms of helping with the cost, for example, with NHF, that would help with the cost of medication and with the cost of seeking help. It also comes in the form of policies garnered at making mental health services more available and more accessible to persons in wider areas. So I mentioned that in terms of this aspect of it, the community-based approaches, what we find are what other countries have found to be effective in terms of helping persons to come in. In our setting, it is both good and bad because some persons might not want to seek help closer to them, but at the very least, the policies would put in the place that there are centers in multiple areas, in both rural and urban areas, where persons can get the access if they need it, as well as there are services where persons would go out into the community help to go and help persons who have a mental health emergency. So it starts at the policy and then implementing the policy and incorporating all of the relevant persons, the faith-based organizations. Nowadays, I realize that there are a lot of churches, for example, that offer counseling services in terms of relationships, in terms of handling death, in terms of having a child that is quote unquote bad behaving, because some of what we call bad behavior is really mental health in disguise. So yes, it would start in terms of that, it would start with the policies being there that would allow persons to do this.
Okay, thank you. So by social protection, though, I was, and not that you would know, I maybe needed to have elaborated more. So for example, men being able to access, money or food or things that can help them then to be the man that they ought to be or we expect them to be. So, you lose your job and you're now unable to provide for your family. What is out there to help you, to prevent you from spiraling into depression, or to reach a state of mental unwellness? So that's really where my thoughts,
Well, you're talking more preventative versus treatment after the fact.
Right.
Well, unfortunately, there is a limited amount of resources out there. There are some. Most common one that person will utilize is the PATH program, which you also have to qualify to use, and this is more geared at the elderly and children in school. What has also happened recently, well, a couple of years now, really, there are also skills training programs offered through HEART that is free for most persons, and they even get a stipend to help, like with transportation and lunch when they get in. But a lot of persons, again, don't want to go back to school or don't know that the service is actually available. For a person who is already working, they intermittently have work programs, but sometimes they are not heavily publicized because the minute it goes out, before it even reaches a wider audience, most of the times the slots are filled because there are limited slots. There is also housing, which is mostly packed. So if a person loses their job, unable to pay rent, there are also shelters that they can go to, and there are quite a few of them. Most of them are in the corporate area or in the urban areas. They don't tend to be as prevalent in rural areas, which is another thing that we need to work on. But there are also housing shelters or temporary housing for persons who would have lost their housing and they can live there. Some persons have been living in some of them for many years, but they're trying to reduce that now because the aim is to get persons to get back to society and to be a productive member of society, because some persons who get in, they found years, they go there and they stay there forever. They want to leave. But again, even with those services, the resources there, the conditions might not be the best. And a lot of persons do not want to utilize them because, again, because of pride, and also they're the ones that do not know how to access the services because they don't even know that they are available. But there are a few, but it still needs a lot more support in terms of governmental support and individual support, like persons going to volunteer for children, not specifically men no, but for children, there are also a lot of homes that will have children in there from as young as primary school level, and they take them straight up to finishing high school. They pay for them to do CXC, or if they that pathway is not for them, then they also pay for them to go through skills training. And the last time I checked, they had a program when they finished the training, if they, for example, went to hire to get some training, they would help them with their first couple months worth of rent, just to give them a head start in terms of getting a job and a salary. So there are some services available. It's just that it needs more.
Okay, thank you so much.
Thank you.
Before we move to any other question, I think now is an appropriate time to ask for a motion to extend the meeting by, let's say, 15 minutes so that we can complete.
So moved.
Second.
All right, so
Thank
all in
you.
agreement?
All right.
So the ayes have it.
DP Joan, I think I see your hand up.
Thank you, DP Stewart. Great presentation. I join with the praises that were given earlier. Dr. Kerr, my question is regarding the men who are fathers, caregivers, and so forth, who may not have a circle to, I guess, voice their concerns, so to speak, because you do have some men who have a very small circle or none at all. What if, just a random question, what if they do not know what you have described as stress, or feeling overwhelmed? What if they genuinely don't know? So in other words, you mentioned, accepting the fact that something is wrong, but what if they genuinely don't know? So you have persons who are always on a high, so they're not really sure. They think that that's just the way of life, and a lot of times, because of how men are wired and how men are cultured in our society, it is expected. So you have some of them who will feel the burnout and say, boy, I'm really tired. But some of them they think it's an expectation even for themselves. Is that something that that you've seen during your practice?
We see quite frequently. In lots of the instances, though, it's one of the persons from the very small circle that would bring them in. More recently, a lot more persons have been also seeing it in the media. So that is where the media aspect of it comes in, the promotion of the signs to look out for on TV, on radio, on social media, to make sure the information is out there so that persons are able to see it. Because again, if it's somebody with a small circle, who some of the persons in the circle, they themselves might not be aware of this information as well, it's important that there is a strong media campaign to promote mental health, to show what the signs and symptoms are for the different things, and to let persons know where they can go and seek help. So that's really the only thing, because if we don't know and they don't know, then the help won't reach them. So
Right.
it's really to make the information of what to look out for more available to the general audience.
Okay, thank you so much. And if I may, my other concern is always with persons with disabilities, if it's mental disability, so to speak. My concern is always with them because by default, they process things differently. So a lot of times they're, you know, the way they receive their stimulus and so forth, it may be overwhelming just at the get-go. So I'm always concerned in that regard too, because we are ahead in some cases in terms of the Caribbean, but we have a long way to go in terms of even awareness and so forth too. So
and reducing stigma and also accessibility to certain forms of treatment as well.
Right.
Of note as well, I forgot to mention in regards to the question before in terms of social protection, mental illness is now on the disabilities list. So persons with a verified mental illness or disability, specific ones, of course, can actually file for disability benefits in Jamaica. It might not be as significant as one would receive in, for example, the US, but they are able to file for disability benefits.
Yes.
Thank you,
Thank
Joan.
you so much.
Stephen, I see your hand up.
All right. Thanks, DP Stu. Good night, everyone. All right. So my question is, I would say on the heels of the last person who just asked their question. So mental health, for me, has gained prominence in most recent years. And for some, it's almost like, you know, two nice buzzwords. The question I have is, has there been any significant improvement in some of the key indicators here in Jamaica to say, especially as it relates to men, that, you know, some of the things that, let's say, you know, companies are doing, communities, you mentioned the media a while ago, to say that these things are working. So, for example, you know, we could say the suicide rate among men could be an indicator of sort. Is it working? Pretty much is the question that I'm asking for men here in Jamaica.
It is working to some extent, because what we're seeing now, which also will result in an initial increase, is that in the numbers, is that more persons are coming in for help. So less persons are suffering in silence. So what this might result in is a higher rate of depression, but a lower rate of suicide. And that's just because more persons are coming in when they still have depression and before they've attempted or successfully committed suicide. So the campaigns that have been going on now are, I think that they're impactful, and I think that they have been somewhat reducing the level of stigma and making persons more aware. So again, more persons are able to access, are coming in to seek access to the care that is available. So it has changed in some regard. In regards to companies, there are some companies, like I'm told, NCB, who they have wellness policies that incorporate mental health concerns. And there are other companies, I'm sure, that probably have them as well. Unfortunately, it's not something that is widespread as yet in terms of companies implementing them. In terms of schools, every school now should, at least at the primary level, should have at least a counselor. And we're also finding that there are more schools sending in persons for treatment, because many a times, even just last week, I was in the emergency room. A child was having what would be deemed as an episode at school, and it was a guidance counselor that sent them up to the emergency room for treatment. And these things have been happening throughout the years, but they were usually, again, brushed aside for both men and women. But now more persons are coming in, more persons are trained. So yes, to answer your question, I do believe that it is helping. We're not where we need to be yet, but it's moving in the direction where more persons are coming in, which hopefully in the long run will help to reduce the numbers.
All right, thank you.
Before I go to Dr. DP, you already say there is a question in the chat. Someone is asking, June is asking if there is a link between autism and mental illness.
Well, autism is considered a mental illness. It's also something that we do see in clinic as well. Usually we see more of it in clinic, in children, I should say. But there's also adult autism and autistic traits. Nowadays, it's what we in the mental health community consider the design of mental illness, because you find that a lot of persons are online and in social media promoting, oh, they have autism and ADHD as well. So it's almost seen as if something to have. But autism is something that we do, that it is a mental illness. It is in the DSM-5, which is a diagnostic manual that we use, and there are several services available. Persons who have autism, though, are predisposed to other, have an increased risk of developing other mental illnesses, like depression, like schizophrenia, and also cognitive impairment. So they are increased risk. So there is a link with it and other mental illnesses, but autism itself is also a mental illness, or considered as a neurodevelopmental disorder.
Okay, thank you. DP, you ready to say?
Yes.
Your time?
Yes, thank you so much for this opportunity. Great presentation, Dr. Kerr. So, my question is, how do people, or where do people get access resources, financial resources to help them for, kind of piggybacking on two earlier questions, and then your response about them getting, there's financial resources and all of that. How do people access it? Do people know where to apply, or who to go to, or are there social workers in charge of this, or is there information out there? How do people access these other resources, apart from being the illness, which you can go to the hospital and go see a doctor, but how do they access financial or housing or other resources that are available?
So that starts with them first having a formal diagnosis, because most of the places that would offer the social services would also want to see verification that persons genuinely are qualifying for these benefits. So it starts with them being diagnosed first. Social workers are a part of the team in most facilities, and they are a critical part of the mental health team. In fact, usually we have psychiatrists, psychologists, nurses, psychiatric health aides, social workers, among other, and the community health workers as well. Most of this information in terms of accessing these services would be available through the mental health social worker, as well as other persons like the doctors and the nurses would know this information as well. But it's not something that is currently put out to the general public, but it is given to the persons and their next of kins when they come in and verify, and we also find that there is a need. So, for example, someone who comes in diagnosed with autism, we might give you information on how you can access and join the Jamaica Autism Association, or you might join the Jamaica Council for Disabilities and how you can see benefits. So, for example, persons who have autism, the family can apply for multi-stipend, albeit very small, to help offset some of the costs for care, like for getting a shadow at school and all of that. So to access this though, you have to first come and get diagnosed and then take it from there, essentially.
Okay, thank you so much for that response. I appreciate it.
Okay, I think we're about to wrap now. We can wrap. But Doc, just let me ask you this last thing. You talked about good sleep. Now, are you talking about the person who cannot fall asleep or can't sleep well or are you talking about a person who chooses not to sleep as many hours as is recommended? People sometimes, yeah, which is it?
All of the above. So it involves persons who have difficulty falling asleep, as well as persons who have difficulty staying asleep, as well as persons who choose to have less sleep because of probably studying or work for prolonged periods of time, because that throws off your circadian rhythm and that throws off your neurohormones, which are the hormones that impact mood, and the hormones also responsible for are associated with most of the mental illnesses. So for example, melatonin is a critical one. When you have low levels of melatonin, you might see certain symptoms in terms of your memory. You might have lower levels of serotonin. Serotonin, if you have inadequate sleep, and lower levels of serotonin are associated with depression symptoms like the feelings of sadness, the fatigue, and all of that. So all of the above.
Wow. Okay, President
Stuart,
Zuri.
if I may add on to
Oh,
something you just mentioned to the speaker. I was at a function on the weekend and we were talking about not being able to sleep well. Even men. It was both between men and women. And the conclusion we had is that what all of us had similar is what you take to bed on your mind that affects your sleeping condition, and how we can actually try to overcome that so that we can get a proper sleep. Doctor, do you have any suggestion on that? We were fighting to come up with some conclusion. It's what you take to bed. Maybe you are worried about something. Maybe there's something on your mind. Both men and women came up with the same thing.
So in terms of what you take on your mind, that is one aspect of getting the sleep. There's also the environmental conditions that you're in. So for example, studies have shown that persons sleep better, they have more restful sleep, or what we call REM sleep, in cooler conditions. The level of lighting as well also disrupts sleep. So if you have bright lights in the environment, that disrupts sleep. That also includes light from your phone screen, so not taking the phone to the bed. In terms of the problems that you might be having or the stressors, that is where a greater challenge might be, because while you can put down your phone, you can turn off a light, or you might be able to adjust the temperature, the problems in your mind are more difficult to move out. You might be thinking about, oh, this happened yesterday and I have to finish this up, or this happened earlier in the day, this person said something about me. That is where you start with your mindfulness techniques, your grounding techniques, and some amount of what we call cognitive behavior therapy. So for example, a method a lot of persons might find helpful before going to sleep, things that are bothering them, just to write them out or type them out into one area, sort them out, and then set designated times, and then go to your bed afterwards. Find that a lot of persons, once you can get it from out of your mind and on paper and look at it physically, or in text if you prefer typing, you find that it is less likely to come back in your mind and prevent you from sleeping. There are other things that you can help to calm yourself down, like coloring, which some people enjoy. And there's also the help from medication if it gets to that point, sleep aids, DPH, melatonin, which is over the counter, magnesium glycinate also helps with sleep quality. It doesn't help you necessarily to fall asleep, but it helps with having more restful sleep. So you might combine the magnesium glycinate with melatonin, which are all over the counter things, because melatonin is a compound that is naturally produced in the body. So it's a combination of behavioral changes and adding adjunct medical treatment if needed.
Okay.
Thank you for that.
Right. I kind of just wonder how it's not just the amount of sleep you get, but when you sleep. So when the hours that you actually sleep, what is the final recommendation then, Doc? What is ideal?
In terms of the number of
hours
hours
and when?
Oh, you mean when? So the when is more important depending on like your regular schedule. So for example, if you're a night worker like a security guard or something, it might be more difficult to fall asleep at night. Nighttime is usually better for sleep because levels of light tend to be lower because there's not the sunlight obstructing you. But if you can simulate those conditions during the day, if you have like blackout curtains or stuff like that, then that can help to simulate the quote unquote nighttime experience. In terms of the number of hours, the recommended is 7 to 9, which most of us don't get, because I know I don't get that most. Some studies have shown that persons can survive well enough on even 6 hours. So when you fall asleep, ideally would be depending on when you need to start your day. If you need to get to work, say 8 o'clock, you need at least 6 hours of sleep. You need time in between to get up, get ready, and for a commute. Then you might want to go to bed by latest. Let's say you want to get the 8 hours, latest 10. If you're a night worker now, obviously you'll be sleeping when you come back, because in theory, you're not supposed to be sleeping while you're at the job. But when you do come home, you have to make the conditions hospitable to having restful sleep. Because it's not just about sleeping, it's about having restful sleep, because sleep quality is even more important than the sleep quantity, I should say. So you can't look at the number of hours in isolation, but also the quality of the sleep when you actually get it. So the conclusion is 7 to 9, usually 6 hours you can get away with. The time of the day is not as important, though nighttime is recommended, but if you can simulate the nighttime conditions during the day, then that should be fine as well.
Okay, President Zuri.
All right, thank you. Thank you all for your participation. It was indeed a very interesting presentation, and there are some lessons that each of us can take away and some things for us to practice as well, especially as it relates to getting those sleep hours in. But the duty is not mine to do the official thank you. That is for Kiwani and IAJ Mattis, and I'll invite him at this time to do the vote of thanks.
All right, thank you so much, President Zuri. Good evening, everyone. As we conclude tonight's session, I would like to extend our sincere thanks to Dr. Kevon Kerr for such an insightful and impactful presentation on men's mental health. Thank you for highlighting not only just the importance of mental health and mental wellness, rather, but also the barriers that often prevent men from seeking help, whether professional or personal. Your message definitely reminded us that seeking support is a sign of strength and not weakness, and that early conversation can truly change lives. Also to the Kiwanians and friends who, came and was a part of the discussion, contributed to the discussion. I thank you so much for your insight. And so I'm encouraging you all to just leave here committed to breaking the stigma, as was mentioned, supporting one another, and just creating space where men and, everyone in general feels safe to speak and seek help and heal. Thank you.
Thank you, Kiwani and IAJ. We have a certificate of appreciation for our guest presenter this evening, and we will find a way to get it to you, Doc.
I'll try and put it up. I just kind of couldn't find it a while ago, but I'll put it up. Continue.
Okay.
You can continue.
All right. So I spoke to the Sarge earlier this evening, and he told me he was on the road, and so he could not make it to the meeting this evening. But at least I know he's back in the country. So the blanket fines continue because, again, I'm going to encourage you to ensure that your Sarge gets here. And because there's no record of anyone paying their fine from last week, the fine this week is $600 per Kingstonian. All right. Notices, announcements, and interclubbing opportunities, and those will be brought to us this evening by our DLG William Reeson.
Thank you, President. Fellow Kiwanians, I cannot underscore the President's appeal to members who have outstanding ticket collections for our recent Barbie Fry to do so as soon as possible, as we have caterers to pay, and it's unfair for them to provide the food. We eat their food and we haven't paid for the meal. So please bear that in mind. May I also invite Kiwanis clubs who are present who would like to partner with us. We're having a benefit performance of National Dance Theatre Company on Saturday, July the 18th at 8 p.m. Cost of ticket is $4,000. We took the house, which is 580 tickets, of which they retained 150. So we have just over 400 tickets. Now, Kingston on itself cannot sell 400 tickets. So over the years, we have invited other clubs to participate with us. The price of a ticket is just under $1,000. So if you sell it at $4,000, you're going to make $3,000 for your club. So clubs in 23, particularly in 23 Central, and those in 23 East who may be interested, please contact myself or President Zuri. We'll be happy to have you come on board with us. And so far as announcement, there will be a fundraising meeting next week, and the date has not yet been set. But as we speak about that, or let me move on to the interclub opportunities. Now, we have noted there are 3 of note. Thursday, this coming Thursday, Kiwanis Club of North St. Andrew will be having a special meeting, memorial meeting at the Police Officers Club at 6:30 p.m. It would be good to recognize 2 of their senior members who have passed away. It would be nice if we could support them. Unfortunately, President Zuri and myself have to attend. We had acknowledged an invitation by the Kiwanis Club of Mandeville, who is one of our children who will be celebrating their 50th anniversary on the same day, Thursday, June 11th. So we're going to have to divide our team members and support both meetings. And then on Monday is our postponed board meeting that was postponed from last night due to inclement weather. We'll be having that at the Secretariat, and that begins at 7 o'clock. But that's going to clash with the Kiwanis Club of 23 Central Southern Line anniversary meeting on the same night. That's the 15th of June. President Zuri, those are all the notices, announcements, and interclub opportunities. You may want to invite other clubs on the call if they wish to make an announcement to do so now. Thank you.
All right, thank you, dear G. Willie. So if there is anyone on the call who wishes to bring our attention to an event or activity that you are having, we give you the opportunity to do so now. Opportunity going once.
Yes, good evening.
Good evening.
I didn't get to introduce myself when the roll call was being made. I'm Kiwanian Paul Rob from North St. Andrew. Just to elaborate on that announcement that was made just now about the special service, it's a memorial service we are having honoring the lives of 2 of our members that passed recently. Of course, you all heard in the news, DP Ian Fort is one of them, and DP Henry Hall. Yeah, those are the 2 members that we'll be honoring on Thursday night. So for those of you who can join us in person at Police Officers Club or online. We'd appreciate your presence. All right. Thank you very much.
Thank you, Sir Paul. Is there anyone else who would like to announce any activity or event that you having? Opportunity going twice. Opportunity going 3 times. Opportunity gone until next week. We will forego any other business for this week and we'll now move to the thought for the week, and I'm going to invite DP Stewart to do that for us.
Thank you, President Zurich. Okay, the thought for the week, this one, it goes like this. In life, you will realize there is a role for everyone you meet. Some will test you, some will use you, some will love you, and some will teach you. The ones who are truly important are the ones who bring out the best in you. That's my thought.
Very good. Very good.
Thank you, DP Stewart. And I hope that for the upcoming week that you will meet some people that will bring out the very best in you and at the very least will teach you something. With that said, I now invite everyone on the call to raise your glasses with me. Imaginary, literal, figurative, in a toast to Kiwanis International and to Jamaica, land we love. This meeting of the Kiwanis Club of Kingston is now terminated. I thank you all for being here and ask that you do try to enjoy the rest of your evening. Hope to